Hi, I'm Dr. Hunter Best, an Associate Professor of Pathology at the University of Utah School of Medicine and Medical Director of Molecular Genetics and Genomics here at ARUP Laboratories. I'm going to spend the next few minutes discussing the utility of genetic testing for mutations in the BRCA1 and BRCA2 genes in the diagnosis of hereditary breast and ovarian cancer. Breast cancer is one of the most common forms of cancer identified in women in the United States. In fact, it is estimated that 1 in 8 women in the U.S. will develop breast cancer in their lifetime. Although the majority of these breast cancer cases are sporadic, approximately 5 to 10% of breast cancers are thought to result from genetic mutations passed from parent to child. Mutations in the BRCA1 and BRCA2 genes are the most common hereditary cause of breast cancer. Mutations in these two genes result in a disorder known as hereditary breast and ovarian cancer syndrome. Hereditary breast and ovarian cancer syndrome is characterized by an increased lifetime risk for several cancer types, including breast, ovarian, prostate, and pancreatic. It is therefore important to differentiate between sporadic and hereditary breast cancer, as the diagnosis of hereditary cancer can have a substantial impact on family counseling and disease surveillance. Testing for mutations in BRCA1 and BRCA2 genes should be considered in individuals with breast cancer diagnosed at age 50 or younger, those with ovarian cancer, those individuals with simultaneous breast and ovarian cancer, individuals with multiple primary breast cancers in the same or opposite breast, individuals with triple-negative breast cancer, those with pancreatic and breast or ovarian cancer in the same individual, individuals of Ashkenazi Jewish ancestry, individuals with 2 or more relatives with breast cancer with at least one occurring before the age 50, those with 3 or more relatives with breast cancer at any age, males with breast cancer, and individuals with a previously identified BRCA1 or BRCA2 gene mutation in the family. Currently, testing for mutations in BRCA1 and BRCA2 genes is performed by DNA sequencing of the entire coding region of the gene as well as deletion duplication analysis. This test is relatively non-invasive as the sample required is a single tube of blood collected in a purple top EDTA tube. It is important to note that individuals of Ashkenazi Jewish descent should undergo targeted testing for common founder mutations in the BRCA1 and BRCA2 genes found in that population before undergoing full gene analysis. Mutations in the BRCA1 and BRCA2 genes are inherited in an autosomal dominant manner. As such, the detection of a single pathogenic gene mutation in either of these genes confirms the diagnosis of hereditary breast and ovarian cancer syndrome in a symptomatic individual. If no BRCA1 or BRCA2 gene mutations are detected, then it reduces the likelihood that the patient is affected with a hereditary form of breast cancer, but does not exclude it. It should be noted that the presence of a pathogenic mutation in a pre-symptomatic individual does not mean that that individual will definitely develop breast cancer, as mutations in the BRCA1 and BRCA2 genes are not fully penetrant. It is also important to note that mutations in the BRCA1 and BRCA2 genes do not account for all cases of hereditary breast cancer. It is therefore possible that a patient that is clinically affected with hereditary breast cancer can test negative for mutations in the BRCA1 and BRCA2 genes. Additionally, patients with mutations in areas of the BRCA1 and BRCA2 genes that are not tested, such as deep intronic regions, will not be detected by current methodologies. Individuals that test negative for mutations in the BRCA1 and BRCA2 genes but are at high risk for hereditary cancer syndrome based on family history should consider additional testing by a next-generation sequencing-based hereditary cancer syndrome multi-gene panel. More information on genetic testing for mutations in the BRCA1 and BRCA2 genes can be found on our website at www.aruplab.com/genetics.